Brain disease, Alzheimer's Part 1. What is Alzheimer's? It is a severe irreversible memory disorder of the brain. In fact, it is one of the most severe disorders of the brain. Alzheimer's is the most common cause of dementia, which is a severe form of memory loss and seriously interferes with the ability to do everyday tasks and activities. There is no cure for Alzheimer's disease, and it is the fourth leading cause of death in seniors. It is also a progressive disease, and it slowly tolls mental and physical ability. Like Parkinson's disease, it varies per individual. You might not have all the symptoms with Alzheimer's, not all the warning signs. You have different life expectancy, but on average it has an 8 to 10 year average life expectancy. Now let's move on to the symptoms. So the symptoms of Alzheimer's are repeating the same question, becoming lost in familiar places, being unable to follow directions, being disoriented, and not just like you won't be able to know the time and place that you're in, and you won't be able to know, like maybe you're visiting your grandchildren when you're a senior. You won't remember your favorite grandchild's name. And also with that, a normal person, for example, when they are hot, if they're wearing a sweater, they would probably take it off. But people with Alzheimer's don't really understand their surroundings anymore, so they might start to undress themselves in public, so they don't know what is publicly okay. So they also neglect personal hygiene, safety, and nutrition, which makes them not able to take care of themselves any longer. Now, the warning signs of Alzheimer's are poor judgment, being increasingly forgetful, disorientation, difficulty with math and abstract thought, trouble locating the word they want to use, and trouble with routine chores, as well as personality and behavior changes. Now, whom does Alzheimer's strike? Well, older generations have a higher risk. Also, people with family history are 3.5 times as likely to have Alzheimer's. And then for gender, well, women tend to live longer than men, so that does increase the risk with age, but men are also likely targets. Ethnicity, well, African Americans and Latinos are more likely, or have over the period of time have gotten Alzheimer's more than other ethnicities. And high blood pressure and cholesterol, your level of mental activity. Women with hormone therapy have double the risk. People with Down syndrome usually end up having Alzheimer's, and people with head injury will will sometimes have Alzheimer's. Now let's talk about the diagnosis. There is no definite test to detect Alzheimer's, and an only true diagnosis can be obtained through an autopsy when they examine your brain tissue, but that is only after death. And diagnosis is only possible and probable. They are correct 90% of the time, and a correct diagnosis is very important. If they diagnose Alzheimer's as something else, like another neurological brain disease, which it might be very similar to, such as Parkinson's, they could give the patient the wrong treatment and the patient might end up dying. It is also very challenging because there is no, like I said before, no definite test of knowing if they actually really have Alzheimer's. Now let's talk about what they use, the use of these processes for diagnosis. So they use a complete patient medical history, medical tests, that would be like brain scans and etc., psychological and neurological tests, which assess memory, language, attention span, and problem-solving ability, psychiatric and other disorder evaluation, so they compare it to other disorders to see what you might have, since there is a group of, I mentioned this in my Parkinson's video, a group of diseases that have Parkinsonism, which is a similar type of symptoms. And then drug reactions, how you might react to a drug for Alzheimer's versus a drug for Parkinson's. They'll look for poor nutrition and metabolic changes, as well as aging conditions. cause of Alzheimer's disease? Well, first of all, I would like to say that there are no clear-cut answers as to why Alzheimer's disease is caused by, what it is caused by. These are just predictions. So first we have genes. It comes from the genes. That we are sure of though. That it usually runs in the genes. We just don't know what the underlying cause is. So it runs in the family and it comes from a gene mutation in chromosomes 1, 14, and 21 is what they have pinpointed so far. Another possible cause of Alzheimer's disease is beta amyloid. So, beta amyloid is an abnormal protein found in the brains of Alzheimer's disease patients, and it is a fraction of a normal protein in the brain called APP. Why APP splits in Alzheimer's disease patients is unknown, and they do think that it may play a role in how Alzheimer's disease ravages the brain. Next we have tau, or tau. It is a protein found in the nerve cells of the brain, and it causes Alzheimer's disease patients to behave differently, and it causes Alzheimer's disease patients' nerve cells to behave differently and gather entangled filaments in the neurons. And it is also present in other degenerative brain disorders as well, such as Parkinson's. Then there are also cardiovascular risk factors. So, scientists and researchers have found that there's a possible link between heart disease and Alzheimer's risk factors because high cholesterol increases the risk of Alzheimer's, and high cholesterol increases the risk of Alzheimer's because it increases beta amyloid deposits, but why it does that we do not know. Another possible cause of Alzheimer's is oxidative damage from free radicals. And it is new, and the National Institute of Health, and I'm going to quote this section. Hold on, I'm going to quote this section. The passcode? Oh.
Something else.
4563. Okay. I asked me to get my backpack.